I'm watching the fireplace log, and it's the most exciting part where the arm reaches in and adjusts the logs.
Amazing. Okay, so yeah, I think we're live.
Okay, cool. We're just waiting for some folks to join on before we get started at 6.
So, and I have the page open now. So if folks want to put questions or comments in the comment section under the live stream on Facebook, I will monitor those.
Thanks, Taylor.
I'm just remembering also that Corey had mentioned that they might be a couple minutes late because it's dependent on their kid going down for bedtime. So they might be joining us a couple minutes late. So
okay,
yeah,
that's totally fine because we'll be doing the first couple presentations, so it won't be until maybe like 7-ish by the time we start the panel. So
awesome.
I'm sorry to be so late for the warm up, guys.
No, it's all good. Just so you know, we're live on Facebook now. Yay! But it's all good. You're not late.
okay, should I get started? All right. Yeah, so we've got one more person joining us for the panel, but we've got pretty much everybody here so far. So if you're here listening or watching afterwards, we are here talking about the STI testing in the age of COVID-19, and this is one of our events through AVI Health and Community Services honoring World AIDS Day. And if you were out at the vigil earlier, it was really lovely, and hopefully you can make it out. And if not, here's another way that you can participate in some of our activities. So yeah, joining us live, we're streaming onto Facebook right now, and here we go. So first, just wanted to introduce myself quickly. My name is Marshall Kilduff, and I'm I use he, him, his pronouns, and I'm on the land of the Chichen family of the Lekwungen speaking people, sharing fuzzy borders with the Kosepsum, Sianu, Sauk, and Wasanich territories. And I'm a white settler of English and Irish heritage, uninvited settler on these lands. And I just want to express how grateful I am to be able to live and work and play on these lands, because it's a beautiful place to be. And when we're talking about World AIDS Day and this being the beginning of Aboriginal AIDS Awareness Week, I just wanted to emphasize that, we're aware that Indigenous people face greater barriers to accessing testing, treatment, supplies for harm reduction and stuff like that for preventing HIV and treating HIV. And, this is systemic and by design through the process of colonization. And, it's our hope that we can continue to do this work to make, things more accessible moving forward, and continue to work with Indigenous communities locally and build relationships. And to just acknowledge that this is something that directly impacts Indigenous communities a lot harder than it does the rest of Canadian folks. And that's a part of colonization. So just moving forward, a little bit of the plan of what we're going to do today or this evening is I'm just going to talk a little bit about sort of what we're hearing from the community on the ground, and from the various organizations that we're in contact with. And then I'm going to talk a little bit about where and how to get tested right now in these strange times. Then we're going to have a little bit of a quick presentation from folks from Get Checked Online. So they did a recent study with looking at people's behaviors around sexual behaviors and changes around COVID and testing changes and stuff like that. So we're going to hear about that. And then we're also going to hear from the recent Sex Now survey from the Community-Based Research Center. They did a COVID edition of the Sex Now survey. And so there's some interesting tidbits to put out there that will kind of create a frame of reference for the panel that we're going to have eventually. So so that's what we're going to do today. So as far as what we've been hearing on the ground, some of this, the first couple points are from BC CDC, and this actually came through I have a chat. It looks like Corey's joined us. That's exciting. But so in the summer, we did our Summer Pride workshop series, and we did a session on sex and COVID in the time of COVID-19. And BC CDC had somebody come forward and talk to us a little bit about sort of their recommendations and stuff and what they were hearing. And so from what they told us, there's been a 30% reduction in PrEP renewals provincially, which is really significant. There's been a decrease in new PrEP starts, and we're going to see that shortly as well. We heard from BC CDC that Get Checked Online testing on Vancouver Island was down over 50% between March and May, and we'll hear more about that soon, I'm sure. And then we've been hearing from some of our community partners that there's been a decrease in testing at STI clinics around Victoria, and also in other parts of the island as well. And that's for a variety of reasons that I think we're going to get into more in the other presentations. But there's also been, anecdotally, we're hearing an increase in new HIV diagnoses on the island. And again, this is really concerning when we're talking about AIDS Awareness Day or World AIDS Day and Aboriginal AIDS Awareness Week, is that, this is on the rise, and we're not really sure whether this is because people weren't testing and now all of a sudden they are testing and there's a backlog, or something else is going on that's causing this kind of blip. And so it'll be interesting for us to have a little bit more discussion about that a little bit later. But we do know that a lot of the testing clinics were at least temporarily closed, or they had limited in-person hours. And we've been hearing that there's sort of a 3 to 4 week waits for non-urgent appointments. So that's a big deal, big access barrier for testing. So this was just shared with me the other day. This was from Kool-Aid Health Center, where we normally in Victoria offer twice a month a testing night for men who have sex with men and queer, gay, bi, trans, two-spirit men. And you can see the drastic drop off of STI testing in March, and that it's kind of came to a minimum in April and May and is slowly starting to climb back up again. You can see that, PrEP starts kind of dropped to nothing, and they're starting back up again, which is good to see that's starting to trend in the right direction now. And then you can see also that STIs and positive syphilis tests drop down to nothing, which obviously if people aren't being tested, they're not going to be testing positive for anything. But that is starting to climb back up again as well. So this is just an interesting snapshot from one of the testing sites in Victoria and on the island. And I suspect that we would see very similar at other testing sites. So I just wanted to talk a little bit about what testing options are right now, just so that folks know where to go if you want testing and how that works. So a lot of folks, a lot of the sites are doing by appointment only, and you need to call in or submit through their online forms to do appointments for STI testing and PrEP starts or PrEP follow-up. I know that within Victoria area, we've got the AVI West Shore Clinic is open and doing testing and PrEP starts. There's the Island Sexual Health, the Victoria Sexual Health Unit, Kool-Aid Health Center is doing testing and PrEP. And then there's also Get Checked Online, which we're going to talk a little bit more in a minute, and that covers Victoria, Langford, and Duncan. Maybe, Jeremy, not to put you on the spot, but do you want to talk a little bit about testing in Nanaimo right now, what the testing options are?
I absolutely can. So in Nanaimo at AVI Nanaimo at our clinic, we have not experienced sort of a palpable decrease, but that is largely because just about every other site in town was closed down. So we are still operating at full strength. We're doing a lot of telehealth and things like that to sort of help amend the traffic flow a little bit, because we do have what we can have in the clinic. Most of the other testing sites in town, there was probably about a 2-month span where the only other option I had was to send you to a walk-in clinic, along those lines, kind of a deal, the far less than perfect ones. However, we are still able to offer a full selection of services. We're still doing PrEP starts and expanding our services. So it's tough to say if we've seen an increase that is a real increase or as a result of the lack of other opportunities in the city right now. That's where we stand.
Awesome. Thanks, Jeremy. I also just wanted to highlight too, there's a really great resource for folks who are kind of outside of some of the urban centers that we've talked about, is this checkyourself.today. So that's where this map came from. I'm just going to show you quickly the website here. You go to, there's lots of really great information about various sexual health stuff. So do check it out if you get a chance. So again, this is checkyourself.today. And the nice thing that they have is this BC-wide map of various sites that you can go to get various things. So you see there's the PrEP referrals and prescription, HIV support services, et cetera, et cetera. So I've highlighted this testing for HIV and other STIs. And you can see that there's sites throughout the island and in through BC that have been contacted and confirmed that they do STI testing as well as PrEP. You can look at the PrEP folks up here. Yeah, pretty much you go and look at one of these little dots and you can click on it and it'll tell you about where it is and refer you to their website. So this is a really great resource to find out where the closest place to you is to get tested and how to contact them. I can't verify how up to date this is right now, given COVID situation, but it's a good start. So that's a good place to go. So as far as other options for getting tested, at least in South Island, there's Get Checked Online, which I've mentioned, and we're going to talk more about in a minute, but I just wanted to show you there's Victoria, Langford, and Duncan have sites for getting tested, and so here's some of the actual addresses and stuff of the sites for getting tested. And so how it kind of works is you go on to their website and you fill out, you register, you fill out some information about your gender, sexual health practices and stuff like that. And it's going to prompt you to enter a promo code. So the promo code that we've been given most recently is this Island Test. So I'm just going to go to the website right now and show you what you would do. So I'm on the website here. If I was going to create an account, I would click here and enter this Island Test. And so I've already created an account for my own personal life, and so it's already kind of coming up with the information, but what it's going to ask is for you to fill out this stuff here about like name, birth date, contact information, city. It's asking about your sex or gender and what sex you were assigned at birth, because that's going to kind of determine the types of tests that it's going to recommend. It's asking about some demographics like ethnicity, and then set up a security question or whatever. So you'll go to create your account and it'll get you all set up and stuff. So I'm just gonna go back and show you what it looks like when you have an account and you log in and go through it to make a test requisition. So I've logged into my account and this is what you see. And so you can go create lab form, and it's going to ask you some questions about some of your recent sexual health activities. And this is going to determine the types of tests that it's going to give you a requisition for. So asking if you've had any symptoms recently, I'm going to say none. By the way, I'm just making this up. This isn't like, I'm not TMI about my sex life right now. I'm just kind of giving you a scenario of what this could look like. So has one of your sex partners recently tested positive for a sexually transmitted infection or told you that they've needed to get tested? So I'm just going to say, I don't know. What is the sex or genders of the sex partners? Check all that apply. So I'm just going to say male. Let's see, how many people have you had vaginal, anal, or oral sex with in the last 3 months? Let's just say, I'm going to say 3. Which types of sex have you had in the last 3 months? So I'm going to just click a couple of these. Sex toys, sure. Have you had vaginal or anal sex without a condom with more than one partner in the last 3 months? I'm going to say no. If you're HIV negative, have you had vaginal or anal sex without a condom with anyone who is HIV positive in the last 3 months? I'm going to say I don't know. And if you are HIV negative, have you had vaginal or anal sex without a condom, or the condom broke with someone you know or think is HIV positive in the last 72 hours or 3 days? So this is a scenario where PEP might be helpful. I'm going to say no. Have you ever had vaginal sex without a condom or the condom broke in the last 5 days and you're not using any other form of birth control? For example, the pill, NuvaRing, an IUD, etc. I'm going to say no. And then, have you been diagnosed with a sexually transmitted infection in the last year? And I'm just going to say, I don't know. Have you ever used drugs with a needle that somebody else might have used first? So this is something that, you know, that's going to prompt for testing for HIV and Hep C. So I'm going to say no. Just FYI, it's still going to ask you about Hep C because there still is risk of transmission through particularly anal sex of Hep C. So it's going to ask you about that anyway as an option. But have you ever used drugs with a cooker, a straw, or pipe that someone else might have used? So again, this is about Hep C and whether or not you might need a Hep C test. When were you last tested for HIV? I'm going to say 6 months to a year. And then when were you last tested for other STIs beside HIV? And I'm going to also say 6 months to a year. And complete the assessment. And what you're going to get is like a list of recommendations of the kinds of tests that it wants you to get. And so we see that we've got chlamydia and gonorrhea urine. So I want to do a urine test. We're also going to do a rectal swab because I said that I've had anal sex. And then it's going to do an HIV test. And it's going to test for syphilis. So this is part of a blood test. Now it's come up with Hep C as an option. It's not checked off, but if I think that I may have potentially come in contact with Hep C or I want to test just to be sure, I can check that off. And it's going to tell you a little bit about why Hep C testing might be done. And so then at this point, I would go to create lab form. And this is going to create, I won't do it because then it's going to prompt me to actually go through with this test, but it's going to create a lab requisition, like the blood test that you take into Life Labs or whatever, any of your blood testing sites. And you can either print it out or it gives you like a QR code that you can take up to the front desk. And you just go to one of these blood testing sites with your test requisition and you do it right there. So some people like this as an option because it's like, you're not going to a sexual health clinic. You're like going somewhere where it could be a little bit more anonymous. Like you could be going there for any reason. And so this is a really interesting option. And I think it would be great if that can be expanded to further parts of the island that, you know, have access issues for testing and prep. But as it is right now, this is a really great option in Victoria and Langford and Duncan. So yeah, that's all I've got. Did any of you folks, are there any questions on the Facebook, or does anybody have any questions before? No? No? Okay, then.
There are other places in the province that you can access Get Checked Online.
Yeah.
Which, you know, considering that we're on the internet, people could be watching from anywhere. So you can also access it in Nelson, Vancouver. Yeah, there's a few places in BC that's outside of Victoria and Duncan.
Yeah. Yeah. All right. So I guess I'll hand it over to Aiden to talk about Get Checked Online research that they did.
Great, thank you. I'll just share my screen. Perfect. Okay, so thanks, Marshall, for the introduction. I'm Aiden. I'm a data analyst with Get Checked Online, and a broader digital sexual health initiative research team at the BC Centre for Disease Control. So I'm living on unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh First Nations. And today I'm grateful to be speaking at this event about sexual health and STI testing among Vancouver Island, gay, bisexual, and other men who have sex with men during the COVID-19 pandemic, sharing some results from a survey that we had done earlier this summer. So as Marshall was talking about, there have been changes in sexual health service use, a decreased use in our in-person clinic, STI clinics, and on Get Checked Online since the beginning of the pandemic and our response. So our research team really wanted to be able to describe what some of these changes in sexual behaviors and healthcare access to sexual health services may have looked like in British Columbia. And so to do this, we conducted what we called the Sex in the Time of COVID-19 survey. So this was an anonymous, self-reported online survey. We emailed survey invitations to individuals who were at least 16 years old who had visited either the BC CDC's in-person STI clinic or its internet-based testing service, which Marshall talked about, Get Checked Online, which is available in Duncan and Victoria and Langford on the island. Anytime in the year prior to the start of the pandemic in BC. So these were recent sexual health service users who we hypothesized to be sexually active up until at least the beginning of the pandemic. The survey was open for 2 weeks from July 21st to August 4th. That's about 4 months into the response to the pandemic. And in those 2 weeks, we had almost 1,200 surveys completed with 331 among gay, bisexual, and other men who have sex with men. 217 completed from people living on Vancouver Island. So these are Get Checked Online users, and 55 GBMSM in total from Vancouver Island. And those are the results that I'll be sharing with today. So among these 55 GBMSM from Vancouver Island, the median age was 35 years old. Most were white, had completed post-secondary education, and about 3/4, 73%, were full-time employed. And so we first asked about sexual behavior since the beginning of the pandemic. So this is a period between March and late July this year when the survey was administered. So among GBMSM on the island who reported having had sex since March, this chart shows that about 1/3 had had one sex partner, another 1/3 had about 2 to 3 partners, and another 1/3 had at least 4 sex partners since the beginning of the pandemic. Over 3/4 of these sex partners were described as regular partners. 31% were new sex partners, and 44% were casual partners or hookups. 73% also said that they were not living with these sex partners. We asked about worry about being exposed to COVID-19 during sexual encounters in phase 1 of the pandemic, so from March to mid-May of this year, and how that worry may have changed from phase 1 to the time of the survey. So that's at late July, so around phase 3. And about 2/3 of GBMSM on the island reported being at least somewhat worried about COVID-19 exposure during sexual encounters in that first phase, while 33% said that they were not worried at all. 24% were less worried at the time of when they were taking the survey compared to phase 1. 64% had no change in worry, and 13% said that they were more worried. We asked participants about how wanting to reduce COVID-19 risks may have affected sexual behaviors, and almost all respondents said that they were employing some kind of strategy to reduce the risk of COVID-19 transmission during sexual encounters. And this chart just lists the top strategies that people said that they were using to reduce their COVID risk. So among GBMSM on the island, 60% said that they were limiting their partner number, so casual partners or group sex. 55% were masturbating more. 51% said that they were limiting sex to a small number of regular partners or a bubble. 51% also said that they were asking their sex partners about whether or not they were experiencing symptoms or what kind of precautions they were taking around COVID. And another 51% said that they were washing their hands with soap and water before and after sex. 40% said that they were avoiding having sex if they themselves were feeling unwell or having COVID-related symptoms, and 38% said that they were not having sex. In terms of sexual health needs, we asked if respondents had needed or wanted to get tested since the beginning of the pandemic. And most GBMSM on the island, 78%, said that they had wanted or needed to get tested since March, either because of their usual testing routine or for a specific reason. And among those that needed to get tested, about half actually got tested. And among those, 43% said that they had tested through Get Checked Online, with the other 47% saying that they accessed it through some other means, such as a family doctor or walk-in clinic or sexual health clinic. We also asked survey participants who said that they needed sexual health care, if any barriers had caused them to avoid or delay seeking services. 29% of GBMSM on the island who needed sexual health care didn't report any barriers. And the top barriers that were reported are in this chart. So we'll see that 33% said that a barrier was that there was public messaging that they were not supposed to seek healthcare that wasn't urgent. 24% said that they were concerned about getting COVID-19 while at a clinic or lab. 22% said that the place they usually go for testing or care was closed or had reduced services because of COVID-19. And 13% said that they were concerned about COVID-19 while traveling to a clinic or lab. So in considering how COVID-19 specific person-to-person transmission may have been a barrier to sexual health care, we asked if participants would be likely to use different types of service models that would reduce that kind of need for face-to-face in-person interactions and maybe reducing COVID risks. So participants said that they were most likely to use at-home self-testing kits. They were likely to use a service where they would receive test kits or antibiotics at home by mail and plain packaging. And they were also said that they were highly likely to use an express testing service, which could look like a video or a phone consultation with someone before you have to give your specimens in at a clinic or a lab. We also asked participants if they agreed or disagreed with the following statements about their sex lives. And when asked when provided the statement of other people will judge me for having sex during the COVID-19 pandemic, 57% of GBMSM on the island said that they agreed with this statement. And I would feel ashamed if people knew about my sex life during the COVID-19 pandemic. 22% of GBMSM on the island said that they agreed with that. So this is a sample of previous Get Checked Online clients, so it's not necessarily representative of the broader community on the island. However, our results do show that sex is still an important part of the lives of GBMSM, even in a pandemic. And GBMSM are employing a variety of strategies to reduce their COVID risks. Sexual health needs have changed as a result of the pandemic, and barriers in accessing these services, such as those related to concerns about COVID transmission, should always be considered. There's a high acceptability for alternative sexual health service delivery models that reduce person-to-person contact, and they may reduce COVID-related risks. And there's still an ongoing need for sex-positive and affirming sexual health promotion in our ongoing pandemic response. So that's all I had to share today. Thanks for listening. I hope I didn't speak too quickly. And thanks for listening.
Oh, that's great, Aiden. Thank you so much for coming and putting this together on short notice. And yeah, very, very interesting to talk more about that. But were there any questions for Aiden that came up? No? Okay. Then I guess I'll hand it over to Nathan Lachowski to talk about sex now.
Thanks, Marshall. Hi, everybody, and nice to be able to gather, at least virtually today, on World AIDS Day. I'm going to be talking today a little bit about just some of the data that we collected in a survey through the Community-Based Research Center. So let me start my slides. Folks can see that okay? Nice, thanks, Taylor. Okay, so what I'm kind of going to talk about today is a bit of the history of the Sex Now survey, which is this survey that's been running in BC for about 20 years, conducted by CBRC. And this last round of the survey we conducted in August and September of this year, and was really trying to look at the impacts of COVID. And so today I'm going to be talking about the kind of some of the data we have on sexual behavior and access to services, very similar kinds of questions to what Aidan was talking about. So I'll try to kind of supplement that a little bit. And in terms of our population kind of frame, gay, bi, trans, and queer men are included, and we've been working in the last few years to try and improve the inclusivity of the survey for non-binary and two-spirit people as well. So this data that I'll be showing is actually from across the whole country. It's collected online, and it's anonymous, so folks don't have to provide a name or contact information to participate, and they can participate in English or French. Some of the data I'll show you is from our 2019 version of Sex Now, which was collected just before the pandemic really hit Canada. And then the other data from the COVID specific survey was collected between August and September, so just a few months ago. And people can participate, they see advertisements via social media, which is shared by CBRC, but also many of the community partners and agencies supporting us folks across the country, as well as advertisements placed on social sexual networking apps like Scruff and Squirt, and I'm trying to think about some of the other main ones. In 2019, we also used Pornhub. So these are just some of the ads that we used from the previous survey as well. So I just also want to give a quick shout out to the team. I'm just talking with you today a little bit about the results, but there's a huge team of people that make this all possible, and this is many of them. So thanks to all of you good folks, and I feel grateful to get to represent our work. So in terms of who was in the survey, the average age was 42. This ranged from during as young as 15 to up into the 80s. 91% of the folks identified as men, 7% were assigned female at birth, 4% identified as non-binary, 1% as gender fluid, 1% as gender queer, and 0.4% as agender. A diversity of ethno-racial identities that parallels a lot of the previous online surveys that have been conducted. 16% of folks identified as being a person with a disability, and about 20% were born outside of Canada. So that's just a little bit about who's in the study that I'm talking about today. So I'm going to talk you through these figures because they're a little bit colorful and a little bit like much for a lot of people. If you really just want a simple thing, then you can look at the yellow color. And what that really shows is basically the change in sexual behavior from before the pandemic to after the pandemic in the two surveys that we conducted. And basically across this are different kinds of sexual practices. So, and in some, everything went down. So in general, less people are doing all of these things. And that's, of course, across the whole entire community. So I'll talk a little bit more about individual change in a moment. But whether that was group sex, during threesomes, even online sex and camming, we didn't actually see an increase in, which some people might have suspected given how much we're spending time online. But perhaps we're just burnt out, or Zoom has ruined it. I don't know, hard to say. So that's a little bit of some of the sex acts. These are some of the other sex acts that we talked about. Sex acts, I feel like I'm just saying sex ass, which is good, but not exactly what I mean to say. Again, generally things are really just decreasing, whether that's certain kinds of sex with condoms or without condoms. Fewer people are having this kind of sex is really what I should be saying. Then if we ask people about specific sexual practices, we ask them if they were doing less of something, more of something, or about the same amount. So if we talk about sex with a partner they live with, about 40% of people said that they were having less sex with the partner that they live with than before the pandemic. And roughly about half of people were having about the same amount. And a few people were having more sex with the person they lived with. When we asked about sex with partners they don't live with, do you know what I mean? About 3/4 of folks were having less sex with folks they didn't live with. And similar amounts in terms of new sex partners. So we did see quite a change in terms of folks' choices around their practices, which I think are really fall in line with the kind of restrictions and messaging around the response to COVID. When we ask about things like condom during anal or vaginal or front hole sex, what we generally saw actually is that the vast majority of people were reporting about the same level of condom use as they were before the pandemic, which I think is a really important thing to think about. So although the kinds of sex and the amount of sex that people might be having is changing, the use of prevention is generally pretty similar, and similar with PrEP. So only 20% of people said that they were using PrEP less prior to sex with the epidemic. So Aidan talked a little bit about some of the other strategies. I just want to highlight maybe a few others so that weren't maybe as popular, but as folks will know, we are infamous in the world for the BC CDC recommendation for the use of glory holes as a preventive practice for COVID. And we saw that 4% of people reported use of glory holes. I will say, talking to some folks in the community, that some of the my elders in the community were like, well, unfortunately, we just don't have as many glory holes as we used to. So I think this is a question also about the ways in which the physical spaces of our community have changed, and how we maybe weren't as prepared for COVID as we could have been if we had just maintained our glory holes. And that generally 4 to 5 folks did something to prevent passing during COVID in terms of sex. So I think, again, this speaks to really how conscious and active our community is in terms of getting information and putting it into practice. Just quickly around STI testing and barriers, the kind of other half of this. About a third of people in our survey reported some kind of symptom during the epidemic, and we would say folks who have symptoms certainly are during a particular priority of need for services. And a third of people reported an STI test since the start of COVID. So some people were still able to get some form of access to services, but that half of participants said they had a delay or skipped testing as a result, or since COVID started. And half of people, that was due to clinics or services being closed. 40% of people said that they felt it was too high risk to visit a clinic during COVID. And then I think some of these others that are a little bit lower on the list are also just really important things for us to remember, that just because COVID seems to occupy and suck up all the space in our lives doesn't mean that things like STI stigma and shame about sex have gone away. And so there's still stress and anxiety and depression that impact our ability to seek services and to live our lives, as well as some of the structural barriers to care. During Corey was talking a little bit earlier about some of the spots across the province that have Get Checked Online. But there's lots of folks who live outside of those spaces that either have to drive to access that, and so some things might be too far away for some people to access. We did ask about home testing as well, and again, this shows in purple the kind of pre-COVID results, and in pink the COVID results. I think it makes COVID seem more fun when it's hot pink, right? So what we generally saw here is that in general, there wasn't a huge shift in like uptake or interest in home testing. It was generally pretty high before COVID. We did see about an extra 10% of people said that they'd be very likely to use home testing. So I think there is some possibility there in terms of new forms of delivery. And I think the kinds of evidence that we're building through this survey and Aidan's survey are hopefully going to create the right kind of impetus for change in the sector around that. But I do think it's important to note that home testing isn't going to work for everybody for a lot of different reasons. And so again, it's not going to be a replacement for the need for in-person clinics and services as well. I just want to briefly share a little bit about HIV testing and care because it's World AIDS Day as well. We did see that 30% of HIV negative guys who were in the survey said that COVID caused them to delay or skip HIV testing. And that generally guys were feeling like there were less guys that felt they were at high risk for HIV than before the COVID epidemic as well. So I think that kind of reflects a bit of all of the things we've talked about here. And in terms of folks living with HIV, during a third of people said that COVID introduced new challenges in their care around managing HIV. So a half couldn't get care because the facility was closed, a third had a delay in getting their meds, and 1 in 10 were unable to get their normal medications. So I think we can see the way in which COVID has had broad impacts for guys across our communities. And in terms of the virtual care, this is kind of one of the other things that's been talked about as like solutions or opportunities to try and address access barriers. For those guys with HIV that did have virtual care, 2/3 said that they were satisfied with that experience, which does leave a third not necessarily feeling satisfied with that. So things for us to chew on a little bit and maybe talk a little bit about on the panel. And just lastly, I want to talk about the HIV self-test. If folks haven't heard, there's a new self-test for HIV that it was approved last month in early November. It's not actually physically available in Canada yet, but it is, you could go online and the estimated cost of this will be is $35 for a single HIV self-test and $55 for 2. This is obviously a huge barrier, whereas a lot of our testing services in BC at least are free for service, or free, I should say, if that makes sense. So having to pay for this is going to be a major barrier for a lot of folks. And so the question will be, how will people be able to actually access this, and who will it be able to help? As part of CBRC, we're going to be doing a new survey in 2021. We'll be giving people the chance to do Sex Now Online, the questionnaire, and they can opt in to receive up to 3 free HIV self-tests as a part of that study. So you can watch your social medias for that early in the new year. And that's one way that we're interested in providing test kits to the community to see who's interested in using them, how they use them. And for us, this is also about providing test kits where some folks feel like, do they have people in their lives that might benefit from access to this kind of test? And so we're interested in supporting that as well. But I do think self-testing also begs a lot of questions that, again, might be things people want to dig into on the panel. June, how do we ensure benefit in these kinds of changing services for those who most need it? June, what support do our communities need to understand, to access, to use, to respond to the results of these kinds of new testing approaches? And also, how might these tests contribute to stigma and coercion? And we can think about environments where you might show up to a sexual encounter and someone's like, here's the self-test, June, I want you to use it. June, what kind of pressure does that put? So these are really important questions, and not ones that I'm obviously going to answer today, but I think they're conversations we need to start having as a community and start thinking about what are the kinds of resources people need and how can we help support you in that. So I didn't start my timer when I first, so that was technically 10 minutes, although I didn't do the best job with that. But thank you for inviting me today, and look forward to the conversation tonight.
Thank you so much, Nathan. And we have one question that's up on the Facebook page right now, which is I think the question that's on everyone's mind, which is, where do we find glory holes?
I mean,
which is a great question, I think, right? Like, I think a lot of people really wonder, like, okay, so glory holes, great, thanks CDC. Where's the map, you know?
I can speak a little bit to that. And Shane might have some more thoughts too, but there is on Squirt, there's Squirt's like a good online hookup and cruising site, and they have like local, you can search your closest to you local cruising sites, and some of those sites actually have glory holes, so you can find out information about that there, and stuff like where to, like when to access, how to, you know, how to do it, like how to do it safely. And some of them are like in people's private properties or yards, or some of them are like in public washrooms and stuff like that. So there's like some tips on, you know, discretion and stuff like that. So that's a way to find out. Shane, I'm not sure if you have any other thoughts, or anyone else.
I mean, I think that's a good resource, Marshall. Oh, sorry, Shane, go ahead.
Yeah.
Sorry.
Yeah, I agree with you, Marshall, but I also agree with Nathan that there's not as many as there used to be. I know growing up that there was always, generally, you know, most public toilets would have at least a peeping hole. And I grew up with them, so I think they're a fantastic sexual tool, you can call it. Yeah.
I mean, I'm all here for the like environmentally sustainable, build your own glory hole kits that we could mail out. I mean, I feel like that'd be an awesome campaign, but I think it probably needs a bit more than that.
I actually did an art exhibition back in the 90s, Glory to the Whole, a lot of screen prints that I did with viewpoints of, that was a fun one. So my interpretation. Thanks.
Anything else to say about glory holes?
I mean, I've spoken to some of you about this. I know that the city is like giving out funds currently for place building, like community funds, and I can't see how it would involve the acquisition of materials, skills, or design that don't already exist within Parks and Rec or basic like city engineering. It's really just about like establishing what the appropriate place is. And they've already done all the surveys in terms of like what parts of our parks are appropriate for things that people don't want to see. They've already got the maps laid out. So really it is just a matter of, you know, an acquisition, you know, add a work order for some city works people. There's there's no reason that the city shouldn't be like setting something up in some of our parks.
There is a porn company that is offering $100,000 to Adrian Dix's to help build glory holes around the province. There we go. We've got $100,000 to drill holes in walls.
Nice.
Be a really good drill.
And hopefully finish walls.
Yeah.
Yeah, sanded.
Yeah, sand it down for sure. Okay, well, thanks so much for coming together, Nathan and Aiden, on short notice. I'm really glad that you were able to make it out and add a little bit more sort of depth to the conversation that we're going to have. I think now would be a good opportunity to have the panelists introduce themselves. So that would be Shane, Jeremy, and Corey. And then, yeah, if you want to do like name, pronoun, and what territory you're on, if you know that. And then maybe Taylor, you can launch into asking questions. Does that sound good?
Yeah, absolutely.
Cool.
Well, I'll start the proceedings. I'm Shane Jeffrey. I'm a casual health promotion educator with AVI, specializing in STI/BB for the GBMSM community, which I could refer to as my tribe. I use the pronouns they, them, their, takes the gender right out of everything. And I'm grateful and I'm humble, and I'm an uninvited guest on the lands of the Lequagan speaking peoples. And I too also acknowledge the disparities with STI/BBs with the Indigenous peoples. But as I was saying earlier today, I want to also acknowledge and give kudos to those HIV positive Indigenous people who are going back into their communities as positive leaders and changing stigma and the whole thing. So kudos to them as well. Yeah, that's me.
Awesome. Thanks, Shane.
Do you want me just to jump in?
Sure, yes, please.
I'm Jeremy Mayu. I use he, him pronouns, and I am living in Snuneymuxw territory. I have been living with HIV for 2 years, and I've been working for AVI Nanaimo as a wellness the summer of 2020, the fateful summer of 2020. So it's pretty interesting times for me. I pride myself in stretching the boundaries of what qualifies as education. So you can be certain that we will be discussing glory holes in great depth in the coming months in Nanaimo. It's literally the first question in our office when Bonnie's done her daily chat. Did she say anything about glory holes? They're still clear. So thank you again, CDC, for the great work you guys do. And I can pass it to, is Corey the next person?
Hi, I'm Corey. I am also in Lekwungen territory, and I use they, them pronouns. Yeah, that was it, right?
Totally. That's awesome. Thank you. And Marshall, you're also going to be a panelist for this. You've introduced yourself a little bit already.
You can introduce yourself as well, now that you're chiming in.
I suppose I can, yeah. So my name's Taylor. My pronouns are they, them. And I'm the manager of the education team on the South Island for our AVI office here. And I'm currently actually at home, which is on the territory of the Malahat Nation, so part of the Wasanic people. So fuzzy border to the north with Cowichan tribes and fuzzy border to the south with the territory of the Lekwungen speaking people. So very excited for this panel, very excited to hear from all of you. And I didn't tell you this before you introduced yourselves, but I'm going to ask you to answer the questions in the order that you introduced yourselves. So, you know, just for flow, just so that we get through all of the questions. And of course, if you're feeling very inspired and you want to jump in and have an organic discussion, by all means. But otherwise, I'll just ask you to go in the order that I'll call on you in the order that you introduce yourself. Sound okay? Yeah. Okay, so the first question we have for you, our wonderful panelists, is just how did you feel when you first started going for testing? So thinking back to that time, you know, when you were new to testing, when you were first starting to go, yeah, how did that feel for you? And what tips do you have for someone who is getting tested for the first time? So we'll start with Shane.
Okay, well, I'm probably one of the generation that's been most tested since I was a teenager. It's coming up to 40 years now that HIV has been in our lives, and it was at the same time that I was coming out sexually. So as I'm sort of breaking down that closet door, I'm confronted with these hysterical headlines coming from New York. The boy from Oz was quite sensible, and I started getting tested pretty much, you know, when that was a preventative. It was strange times back then. It was more about survival, and every test just put the dread in not only me but everybody. Not concerning me, but for their own testing results. It was every 3 months, and it was pretty much regular. If you had a sniffle or a cough that persisted, you'd go in and have another test. It was pretty much simple as that. The education around it in Australia was kind of mixed, but it was, for me, what I got out of it was a routine. And so I started setting up with every season, was the beginning of each season was the beginning of when I got tested. So that gave me that 3-month regularity and gave me that routine. And I pretty much have been consistent right across the board. Even when I was in a relationship for 16 years, a monogamous relationship, I still went and got tested. That was more out of just that consistency, but it was a serodiscordant relationship. So I was negative and my partner was positive, and we pretty much had condomless sex for 16 years, once a week every 16 years. So it was just routine and taking ownership of my sexual health, not only for me, but for those that my partners. So yeah, that's my history.
Thank you, Shane. I appreciate the point that you shared about fear and initially, right, like when you were first getting tested. And I appreciate you mentioning that, because I think that is a very common experience, right, for folks who are new to testing. And I also really appreciate what you shared about routine and establishing a routine around testing as a tip for folks.
Yeah,
so,
yeah. So it's about being proactive rather than reactive, and reacting to symptoms or reacting to, I may as well just go and get a test. Well, having that 3-monthly sort of routine, it's pretty good. And I must say, it wasn't until I came to Canada that I first got my first STI. So Vancouver on you.
Awesome.
But, so I went pretty much 30 years without testing positive for anything until I became a permanent resident of Canada. So it's now part of my Canadian story, and even Australia doesn't officially know of it. So
excellent. Thank you. Jeremy, so we'll go to you next. So how did you feel when you first started going to testing, and then any tips for folks who are new to testing?
Like Shane, I come from a slightly different generation than some folks, and my first test was, I believe, in 1990, grade 10. And it's been a game of chicken ever since. At the time I was lucky to have access to testing and to have people, that would support that in my community. So, I mean, on one hand, I was grateful. At least we had something, because you grew up in the 80s just hearing about death sentence, death sentence, death sentence. You almost couldn't do it in a way that wasn't absolutely emotionally loaded. Especially back then when there was no option. There was no functional cure, there was not even the cocktails or anything. So scared. You were always scared. And it's like I said, and once you got past your first time, it was like you were going back to play chicken with a drag racer every 3 months or 6 months. You just grit your teeth, stare it in the eye, and dive in. By the time I got in my 40s, it was a absolutely different sort of scenario. I was definitely not as afraid to go in for testing. I hadn't in a few years because I, led what I believe to be a relatively conservative sex life. And so, I mean, I wasn't particularly scared. There were a lot of sort of ghost feelings, but being educated on HIV at the time, and knowing that there were alternatives and treatments really, really helped. That definitely helped in terms of feeling like, okay, it's not the end of the world. And even though this is the thing my mom warned me would happen to me when I was 14, it was a little bit more palatable by that point. So I guess fear is something, fear and sort of ideas about what your fate as a gay man is, what it means to be a gay man in this world right now. Was my mom right to be worried about that, and not that I would just, have too many China patterns or something? I don't have either of those. Like Shane, I did not acquire an STI until I moved to British Columbia, so we can narrow, we can even narrow, Shane. So we have a lot in common in that sense. If I had to give people a tip on what way to, face the fear, would be to bring a friend, bring a trusted piece of support with you, particularly if you have specific reason for concern. Having a supporter with you or somebody that you trust gets half of it out of the way just right up front. It's great to have that distraction and to know if you got bad news that you would at least have somebody to unpack.
Thank you so much, Jeremy. Yeah, that's such a great tip, such an important thing to have that support. Corey, what about you?
Muting. There we go. Okay, so my first time getting tested was at the Planned Parenthood in Halifax, and the nurse who did the testing was this like very visibly queer person who had purple hair, and the space itself, it had a lot of things that helped set me at ease, because I think that I had this, misconception. I had grown up super religious that Planned Parenthood was like all just abortions or whatever. I had this idea that like sexual health clinics were like evil, essentially. Like that was the information that I had been given growing up. And so, as much as I knew that I needed to, I was pretty nervous, and needed to have some affirmation about that it was okay that I was sexually active, and it was okay that I was queer, and it was okay that I was questioning my gender, and yeah, so having that be visible in this space in terms of the way that it was set up and the way that forms, that was almost 20 years ago, and I've seen forms change a lot, right, in terms of what they ask and how, I think about the first time that I got tested at the sexual health clinic here in Victoria, and at that point, they had a pink form and a blue form. And so when you went into the waiting room, like you would get a pink form if you had a uterus. And, I was kind of explaining to them like how that was a problem, but also like, yeah, I am relieved that I don't have to do that all that often anymore in order to access competent care. But yeah, those sort of things that are just like at this point feel like they should be basic, and then also sometimes they're just like haven't been taken into consideration. But things like making sure that queer folks and trans folks, or people who have sexual trauma, like feel like they can be in that space, and that they're allowed and that they're enough, and like that just recognizing that like getting in the door is the hardest part for a lot of people.
Thank you so much, Corey. And I want to come back to that in the next question for our panelists, but maybe we'll just go over to Marshall before we do that. So yeah, Marshall, what was your experience like when you were first getting tested, and any tips for folks who are thinking about getting tested for the first time?
Yeah, so my testing experience was like a little bit odd because when I first started getting tested for STIs, it was sort of like just pre me figuring out my gender stuff and like starting transition. And, I went through sort of like a very promiscuous phase kind of just leading up to that of, I think, just like trying to figure out who I was and what I wanted, and like going through a lot of bad experiences before being like, oh, like there's a reason why this isn't connecting with me. But yeah, and so when I first started getting tested, I went to my GP, who I'd had for like since I was a kid, and that was a really weird and interesting experience because like you're first starting to open up and talk about sex with this person who like has known you since you were a kid and like dealt with all your previous healthcare stuff, but it's like a really deeply intimate thing, and at a time when like I was questioning gender and sexuality and like everything, like it was a really awkward time, and at a time when I didn't really have a name for like why I was so uncomfortable with like my body parts and the sex that I was having and all of that kind of stuff. It was really difficult, and I just kind of like didn't even know what I needed, what I wanted, how to ask for it, and was very nervous. And I kind of just remember, I think, asking like, I want to be tested for everything that like I'm having sex and I want to be tested. And it wasn't until like, I was going in regularly every several months, depending on how frequently I was having sex with new partners and stuff, or having like condomless sex, and thinking that I was going in and doing my like due diligence. And it wasn't until I started, started transition and started volunteering with ABI that I learned actually more about HIV, because it was very limited what we learned in sex ed, and learned that it was a bloodborne thing and it was a blood test to test for it. And I had never been given a blood test when I had asked for STI testing. So it was kind of that like realization that I had been asking for this and I wasn't given it because of assumptions that, of the kind of sex that I was having in my body. And that was really hard. And the first time that I actually like went for an STI test, it was through one of the testing night, or like for an HIV test, it was through one of the testing nights that ABI put on. And yeah, it was scary because I was like, I've been having probably a couple of years now of being fairly promiscuous and not always being consistent with condoms, and having sex with, men who have sex with men. And yeah, and it was scary. And so I'm glad that, like I was able to do it and to go to a space, and we're going to talk more about this in the next question, but like to a space where, queerness and transness were like accepted and understood. And so I think like as much as, you know, I totally, yeah, like I agree with Jeremy as to going with a friend, going with a partner, like having a support person there is a good way to go. And then also like scoping out and doing a bit of homework on where you're going to go testing, especially if you're like a queer trans person who might not have like a GP who's super up on that kind of thing. And, you know, taking just like trying different spaces, trying different options and trying to find the thing that fits best for you. And, you know, it's not always going to be like, not every place is going to be the right place for everyone. And, you know, and also like as a queer and trans person, be ready to like have to advocate for yourself to get the testing that you need. And that's something that's hard to do. And so if you do have a buddy, that makes it a little bit easier. Because, you know, without fail, anytime I go into a new testing site, I need to explain why I don't need a penile swab, for example, you know, and when the assumption is that that's what they're going to do when they see me. So yeah. Anyway, that's what I've got.
Yeah, thank you, Marshall.
Can I just add to that, Marshall?
Absolutely.
And thank you for the truth. The advocating, I really strongly believe in, but also the knowing, and this is where Get Checked Online is so good, that it details the different swabs and blood and all the different variables that you need to either give or and so knowing that when you go to a doctor or going to a walk-in clinic, they're going to make assumptions, and we should be really targeting the GPs here by not making those assumptions. But and so they're going to give you something that they think you should need rather than what you actually do need or require, and it can't be changed from then on. Life Labs are not going to add it to the requisition either. So the anecdotal evidence or scenario that I'm getting a lot of is that someone's going in because they've been told, say for instance, chlamydia, but then they're going to they're getting a requisition only for chlamydia. So make sure that you try and get a requisition that's covering all bases, and know that, you know, to test for chlamydia you need a swab, because that's, you know, what it is. If you haven't been swabbed in your last test, you haven't been tested for chlamydia.
They
So
can,
you're only as good as your last test, really.
they
So
can do urine testing for chlamydia.
was that sorry?
They can do a urine test for chlamydia.
But I do think one thing that's like from one of our studies in the Toronto, Montreal, and Vancouver, we found it during that I can't remember the exact proportion, but a number of chlamydia cases will get missed in the throat or in the bum if only urine is used for testing. So if you're using it for sex, then there should be a test that comes from it, whether that's urine or swab.
Yeah, and I think this is all feeding really nicely into the next question. So I mean, yeah, Marshall, you mentioned the importance, you know, and what a big difference it made for you being able to go to some place that you felt safe to get tested, right? And Corey, you spoke to some of the elements in your first experience with testing that contributed to your feeling of safety in terms of like the actual physical environment and also some of the characteristics of the service provider that you were encountering in that environment. So just with that in mind, kind of if folks could just talk about where they currently go to get tested and why and what you think is important in a testing site, and we can kick it back over to Shane.
I go to the Corley Clinic, which I say downstairs, but and they're fantastic because I've connected with the nurses. They all know me, and the nurse practitioners. I very rarely only ever see my doctor once a year. I only ever see my HIV doctor once every couple of years. But having the nurses, having that no shame, they know me, we can talk freely and openly, and it's great, it's fantastic, until COVID-19. They now have a requisition to go to Life Labs. It's soulless, it's, I find it a little bit judgy. And I find it a huge contamination risk. So I get triggered there. So I don't enjoy it. I don't enjoy the process, and I've delayed it. But I went the end of October. So the 4 times that I should have gone this year, I've only gone twice. Once February and October, but it's been testing times, I suppose you could say. So I'd like to go back to Kool-Aid. I'm going to try the Get Checked Online with some friends, just for the process and see the ease. But I don't have any problem with my requisition from Kool-Aid. I pretty much get everything, and it's the results. You kind of I go in expecting everything, and I'm relieved when I've got a clean bill of health. So that's the only way that I can do it now. Yeah, I have to expect that I'm going to have everything.
Thanks, Shane. Yeah, and I mean, yeah, I think the piece around relationships and having a connection with the folks that you're, being tested by and that you're going to get those results from, it makes sense that that would be a really important factor for you. So thank you for bringing that to the fore. Jeremy, did you want to speak to this question around where you go for testing?
The only thing I'll address specifically is I've gone just about everywhere you possibly could go for testing in my life. I have definitely sat next to a 15-year-old girl while she waited list abandoned for whether or not she was pregnant, and I waited to find out if I had HIV. She was smart enough to bring a friend, so I was not that day. So, but I think the most important thing is that it's medically appropriate and culturally appropriate for gay people. It is so important, and one of the things that we struggle with right now is that addictions treatment is often blended in with men's wellness treatment. And there's certainly stigmas on both sides of that and uncomfortable moments in waiting rooms. I would love that we had dedicated, and I would also find, could wave a wand to make things perfect tomorrow. Any clinic that I was sending a gay man to or going to myself should also have attachments to other services, so that it should be the beginning of a road to wellness, to where you go when you've abandoned the wellness train. Like, it really should be something more like that in the long run, and in a perfect world certainly it would be, but that's what we strive for. So appropriateness is super important.
Thanks, Jeremy. Yeah, anything to add to that, or any different experiences from that, Corey?
Yeah, I'm a big fan of Get Checked Online, so I will wave the flag for that. I started using Get Checked Online when I lived in Nelson, or when I would go to the lab in Nelson. I lived in Slocan, and I have had really inconsistent access to primary care for a number of years, and knowing that I could have consistency in accessing testing without having a primary care provider has been really helpful. I was going to the sexual health clinic in Victoria when I first moved here, and found that was also a really good sort of stopgap in terms of not having a primary care provider, because they were also able to do gender affirming care. And so I was able to go in and have my PAP, my routine STI testing, and get a testosterone prescription and surgery referral, and all of that could happen in one place. Now I have a primary care provider, and so I have actually seen I had an in-person test with someone that's consistent, and I think that there's pros and cons to everything. One of the things that I liked about getting the Get Checked Online since COVID was that I didn't have to go into a clinic. I felt like that was gonna one more point of contact, and also for me, especially during the summer months, I'm a solo parent, and spring break lasted from March till September. So I didn't have access to babysitters or school. I didn't have any time that I didn't have my respiratory compromised 3-year-old in tow. So going to a clinic to get tested or going to a lab to have a, requisition processed was not as straightforward as it could have been. But one of the things that is really nice with Life Labs and Get Checked Online combo is that you can use their app to know what kind of wait time is at different locations. So I was able to print out my requisition and then take my kid to my sister's yard and open the app and see like, okay, there's 3 different locations within the 15-minute bike ride. Which one is the shortest? And then like check in with the app and then bike there and not really have to like hang out for a bunch of extra time because you can check in before you're actually there. So yeah, those 2 things of being able to get the requisition without having to have an in-person contact and being able to time your in and out of the lab a little bit easier have been helpful.
Thank you. Yeah, I mean, yeah, technologically mediated access, there's something to be said for that sometimes, for sure, I think. And yeah, I think you've highlighted a lot of reasons why that can be really helpful for people, and also given a great snapshot of how to go about making it helpful for yourself. So thank you for that. I think that will be useful for a lot of people to have those sort of pro tips. Marshall, did you want to speak to where you get tested and why?
Yeah, and actually I was just going to add, you can make appointments through Life Labs as well. So that's another nice thing. You don't have to like sit for, however long in a waiting room. You can just make an appointment and pretty much walk straight in, which is nice. As far as where I get tested, I had been getting tested through the Kool-Aid Clinic, through the like testing nights that ABI was running previously, and then I moved out to the West Shore, and so more recently I've been doing testing through the West Shore ABI Clinic, and both have been really great options. I found, just as far as like that appropriate care and like spaces where I can be completely open with them about sort of sexuality and gender stuff and not have to like answer a bunch of questions or like have it feel awkward. Those spaces feel the best for me. And, particularly like I can't advocate enough for the Kool-Aid Clinic, and, shout out to Karen, the nurse there who runs the testing nights, that is just like, so they've seen everything and nothing is a shock, nothing is a surprise. And like the first time that, I went in there and it was just like, oh yeah, I don't need that test, I'm trans. And it was just like, okay, cool. Well, here's the other tests that you can do. This is why you might need them. Do you want them? And like explaining that, as opposed, explaining like site-based, like activity-based kind of, here are your options, what do you want? And then it got to the point where I could just walk in and say like, I want a throat swab, a rectal swab, and a urine test and a blood test. And they did it. And yeah, so I think like places that explain the types of tests that aren't necessarily like gender-based or assuming of the types of sex that you're having is really important. I can't remember whether people have touched on like, having a space where there's like pride flags and like trans flags and, posters in the waiting room for things that are relevant to queer and trans folks, is also just like a safer space flag to be like, oh, it's okay to be myself, and be open about my sexual history and gender history. And forms are a big one. Corey talked about having forms that are not gonna like out you or identify you as having a particular set of organs, but then also like allowing space to put your pronouns and your like your preferred name that you use as opposed to your birth name. And things like you can identify yourself as trans if it's easier to do that in a form than having a conversation with the doctor, just so that it's like out there ahead of time. you know, like, yeah, all that kind of stuff is really helpful. I mean, I've had bad experience going to Island Sexual Health, and I had like a doctor who, when it came to doing like a physical exam, because I'd had something that I needed to have looked at, and he was like, I could tell really uncomfortable that I was trans, and ended up asking like another person to come in and observe the examination. And it was like, I think that that's like a technicality that, if you know, I'm assuming that like if a male doctor is doing an examination on a woman, that they have to have like an observer as like a, you know, as like a safety thing or something like that, to like, you know, say that nothing inappropriate happened or whatever. But like, that just felt super inappropriate that they, you know, felt so uncomfortable that they had to bring an observer in to witness the test happen. So, you know, don't do shit like that too. Yeah.
Yeah, for sure. Thank you for sharing. And I'm sorry that you had that experience, Marshall. So just looking at the time, and I think we're hoping to finish around 7:30. So the next round of questions is going to be our lightning fast round, wherein you have a minute to speak to the questions. And we'll see if we can get to the next three, and if we can't, then we won't. Yeah, so next question, and Shane, I'll ask you to speak to this first, is how has your access to testing changed since COVID? Have you noticed any COVID related trends in terms of testing access in the community you're a part of?
Well, I think I answered regarding the barriers that I've had. Can I just also mention the rapid test is also available, and also now approved in Canada, the self-test, which Nathan was talking about before. So they're additional access points. But what I've seen in the community that I belong to, which is pretty much like a party and play, skanky host, we are pretty much defending ourselves at the moment, and it's like imperative that we be confident and positive, and don't take the shame that is being delivered to us, because that's just, you know, I had a bad experience on the weekend, and I'm still sort of reeling from it, but it had to do with slut shaming, and I don't think there's any place for that in sexual health, especially when we're trying to be mature and just take ownership, and not have it like that dirty little secret like it used to be. So yeah, that's what I'd add to that one. Yeah, try and empower everybody to just take ownership, and because it's not only for yourself and your own sexual health, but it's for your partners as well that you're engaging with.
Absolutely. Thank you, Shane. Jeremy?
Yes, as I said earlier, access to treatment as well as testing has become much more limited in my community during COVID. Some of that is because of COVID. Some of that is just because that's how things work, right? And in terms of trends in the community, apparently getting tested for pandemics is super hot this year. But honestly, I would say that in my own community, there's been a lot more discussion about getting tested. I kind of am my own personal little HIV bubble, so I don't know for sure, but I feel like the conversation of general wellness, you know, is stronger in my community than it was a year ago, and about what we need to do in terms of sticking together with each other. So that was under 60 seconds. That almost never happens.
Nicely done, nicely done. And you threw a positive thing in there too, so bonus points for that. Awesome. Corey?
I think I mentioned most of what I was going to say. I was accessing at the sexual health clinic, and then like their clinic slowed down a whole bunch, and sometime during that time, the doctor that I was seeing there stopped working, And it was like you could only book appointments through an automated thing. And so you had to know who you wanted to have your appointment with, but then that name was like not in the automated menu anymore. And so it felt like there was kind of no way to move forward with it. And luckily I got on with a new nurse practitioner sort of around that same time. So it filled that gap. But yeah, I found that the clinic access kind of just like dropped off, as well as my ability to get into a clinic because of childcare access dropping off.
Yeah, major double whammy there. Yeah, thank you. And Marshall.
Yeah, so my experience has been a bit different because I had been, I don't know, I was seeing the nurse out in the West Shore previous, like just before COVID, and was doing that for testing and prep. And then that nurse left sort of just before COVID, and we hadn't hired somebody until sort of after COVID happened. And so my care kind of dropped off at that point anyway. And I had had a test since the last time I had actually had a sexual encounter, and then hasn't, you know, like complete honesty, haven't had one since. And so I haven't really needed testing, and have not needed prep. And so I haven't continued with prep, and won't until I feel like I'm gonna, you know, need it again. But you know, I definitely can say that from the outreach that I've been doing on like online sexual health, or like on hookup apps and sites and stuff, a big trend is that people just not knowing where to go, not knowing what's open, and like you know, just in general, I think that's a problem. But now with COVID, it's even worse, that like a lot of folks, you know, even being out in the West Shore, they don't even know that the West Shore like ABI clinic does testing and prep, and finding lots of people who are just like, oh, that's new to me. So yeah, just not knowing where to go, and not necessarily having access to testing and prep when you need it.
For sure. Thank you. Thanks, Marshall. So I think we'll just wrap this up on a positive note. So the last question, the last question that I want to ask is just, what was the best experience you ever had with getting tested, and what made the experience positive for you? So if we could start with Shane.
The best experience I've ever had getting tested was this really sexy doctor at the Hiv clinic. When he wanted to do the swab, I was yeah, quite impressed. In my mind, and you know, most people don't get that far without dinner, but no, that was probably the most positive. I love it, but I just got a negative moment, is when you get the bruise, because I always was told once that the nurses do that when they're being judgy, and it's like, you'll get the bruise. So I always sort of, you know, if you can take my blood and not bruise, you're up there as well. I'll come back to you. Yeah.
Thank you. Awesome. Jeremy?
I'm going to go with two. I'm going to say my previous record holder for best HIV test was, or STI testing in general, would have been my first time when I went to the Windsor in Southwestern Ontario. And the reason why I would acknowledge that as the best is because as a young gay man, a young queer, to be someplace that was all about me, that literally was the only place that was all about me. It was sort of an entry into fraternity or something along those lines. It was my first time accessing leaders in my community and realizing that I had to be beyond the various different village people. And I would say my last time, so my very last time at the ABI was the first time I had come to the clinic, and I knew after living literally from the clinic for 5 years, I was really glad that I had gone, and it became very clear to me that the ABI, particularly our nurse, really had her head around men's wellness, and it was a radically different experience to not have to teach the nurse about stuff. So I knew I was in good hands, which fortunately, you know, since I won the jackpot on that one, I I was glad to be. It made me feel really confident about getting a call in for a follow-up appointment. So yeah, both the first one and the last one.
Thank you so much, Jeremy. Corey?
Yeah, I'm racking my brain, and I actually can't think of an experience where the testing feels positive. It's like, it feels like a chore and a thing that I do because I am responsible to myself and the people that I share my body with, but it doesn't feel like something that I expect to be positive at all. And so I take care of that by making sure that STI testing always is followed by really nice cake. And so like really wherever the testing happens, like there's going to be some fancy bakery like within the close proximity, and that's going to be the highlight.
Thank you. I really appreciate you sharing that. Cake for the win. Always cake. Marshall?
Yeah, yeah, I mean, I definitely echo that it's not like ever a particularly pleasant experience. And I also just want to like touch on that, you know, like STIs happen and they're an uncomfortable part of the process, and, you know, but they're like a part of having sex, and it's totally, you know, like it's okay. Like it's not, there's no judgments. It's okay if it happens. It's probably going to happen at some point in your life. And yeah, so, you know, that's important to note when you're going in for testing, and especially if you're kind of nervous about it. As far as like good testing experiences, as far as testing experiences go, I would say probably the experiences with testing with Karen at the Kool-Aid Clinic, going in for the like men's testing nights, has always been really good. Like after sort of the first time there, like I said, you know, it's just, she explained every test that she does, and I just go in and I say like, you know, I want a throat swab, I want a urine test, like a urine test, and I want I want a blood test. And she knows exactly what that means. I know exactly what that means, and we just do it and we're done. Some of my like best experiences with that was actually like going in for those testing nights with like a friend or one of my exes, and we would do it together and then like go out on a cute little like date night afterwards. And yeah, definitely echo the like rewarding yourself for doing it afterwards, because it's like an uncomfortable thing to do, and it's good to like have something to follow it up with.
Yeah, putting the pleasure back in testing, right? Or at least the moments after testing, as the case may be. Super important. Well, we're just past 7:30 here, so we should probably call it a night. But I just want to thank all of you so much. And this has been a really interesting session for me personally. And I really appreciate Aiden and Nathan and Marshall for your presentations. That was super, super interesting, and to all of the panelists. And a big shout out to Shane, whose idea this was as an event to honor World AIDS Day.
The next one I think we should have is the follow-up, the disclosure, the shame-free disclosure that we need to all sort of get our heads around, which I think would be a good follow-up in the new year, maybe.
Love it. So stay tuned, everyone who's watching right now on Facebook Live. But yeah, big thank you to everybody, and to Marshall for coordinating. And yeah, thanks so much. Good night. Happy World AIDS Day. Happy Aboriginal AIDS Awareness Week.
Thanks for having me.
Thanks.
Thanks, Nathan. Thanks, Aiden.
Pleasure. Thanks, folks. Bye.
Bye.
Bye.